Welcome to Tuesday Tips, everyone. My name is Pam Dunwald. I am one of your nurses from Your Nurse Advocate Consulting. And so today we're going to have I guess, kind of build on the topic we're talking about, and that's transitions of care. And we're going to be talking about effective communications during transitions of care. And for those that may have missed the first part of this video, transitions of care are anytime you have a change in level of care. And what I mean by that, transitions in care is really a medical jargon. And so simply means that every time you change a level of care, for example, by going from home to say to the hospital and back home again, that's a transition. Another transition could be just going to the doctor's office and going home. Another type of transition could be from going from home to the doctor's office, to the hospital, to the nursing home, and then home again. And those are several transitions. So each time there is a transition from one level of care to another, there's risk for medication errors, treatment errors, your primary physician being not in the loop and getting your my chart and things like that all up to date, family members having surprise discharge and they're not ready, or the family's not aware of what's going on. So we're going to talk about communication, because that is one of the key things that can improve to have a successful transition and to reduce the level of potential errors that occur. So let's go ahead and get started. You know, have you ever had a loved one go to the hospital and they come home and, you know, they've missed a doctor appointment or they didn't pick up a new medication? And a lot of times that's during those transitions when they're really at risk for maybe not understanding their discharge instructions, or, you know, maybe you think that everything was fine, didn't think that anybody else needed to be there. But, you know, in the hospital setting, we always recommend that another family member or a good friend, someone to be there to hear the discharge instructions, preferably someone who knows what's going on, because oftentimes if you do know what's going on, you know, if you go, your aging parents in the hospital and you go to pick them up, you get to hear the discharge instructions. Well, if they're listing off medications that you don't know that, oh, well, they weren't on that before, or is this a new medication, or what do we do about this? You can ask those questions before they leave the hospital, because once they leave the hospital, it's lost. Sometimes hospitals or clinics will have what they call transitional care nurses, and they will, for people that they've deemed high risk for hospital readmission, they may call the patient up the next day, 24 to 48 hours, make sure that they've went through their discharge instructions, they've picked up their medicine. But that's just a tiny fraction of the amount of people that actually are in the hospital. So we can't rely on, as family caregivers, we can't rely on somebody else making sure that there's no mistakes. Now, should it be that way? No. But again, as we talk about these transitions, you'll find that it can be, unfortunately, kind of easy for these mistakes to occur. In the first video, and I'll just share this one and then we'll move on. But for those that didn't see the first video, we talked about a situation where your loved one is in the hospital and they are getting ready to go to the nursing home. And so a lot of nursing homes, they'll use the doctor's discharge instructions, discharge summary, because that's something that the doctor signs, as orders for moving forward once your loved one gets to a nursing home. So this is a typed, you know, they dictate usually, and then it's typed up, and the discharge planner or the social worker, someone, the clerk at the desk and on the hospital unit will send this discharge summary over to the nursing home. And so the nursing home is always after the discharge planner of the hospital. Oh, we need that discharge summary. We need the discharge summary, so they can prepare and get medications or get things that they may need before their pharmacy won't deliver, or for any one of a number of reasons, they want to get as much lead time as possible before that patient goes over or gets transferred to that nursing home. So everybody's in a big hurry to get that discharge plan. Well, a lot of that discharge summary goes through a lot of hands. I mean, the nurse that's discharging the patient to the nursing home has eyes and making sure that that discharge summary is correct. The pharmacist usually reviews the medication portion of the discharge summary and makes sure that's all correct. So sometimes, due to maybe a breach in communication, that discharge summary, the doctor says, yeah, it's good to go. Well, maybe someone didn't check it or the pharmacy didn't check it. They send the discharge summary over to the nursing home only to find out a half an hour later, the pharmacist has reviewed it. They found a mistake. Well, if someone, the doctor will go in and correct that discharge summary. But if someone doesn't remember that they need to reprint it, refax it, send it over to the nursing home, they're going to get the original one that was not correct. And so this can snowball. Another example is when a loved one's discharging home from the hospital and they go to the pharmacy to pick up their new medication and they decide they're not going to pick it up because it costs too much. And that is several different levels of communication that maybe have gone wrong. Is has anyone asked them, what has anyone looked into the insurance copay of that new medication they ordered, especially when we're looking at things like Eliquis or Xarelto, the newer blood thinners. Oftentimes those are very high copays, sometimes up over $300, for the prescription. And so some aging adults aren't comfortable paying that. So what happens is they just don't pick it up. They say, oh, I can't afford that. They go home, and how do we know that they didn't pick that up? Maybe it's 2 weeks later when they go to their follow-up appointment with the doctor. The doctor may see it on a list. Oh, how's it going with, you're taking this Eliquis? Well, we didn't pick it up. Well, now they've gone 2 weeks without it, which may put them at risk to get rehospitalized again. So they could end up back in the hospital, especially like a blood thinner. If you're taking that, maybe you went in the hospital with a blood clot. And so if you're taking the Eliquis or the Xarelto to prevent a blood clot, and you go 2 weeks now without getting a prescription, you could land back in the hospital just for 2 weeks because you didn't get that prescription. And that's a fail. I mean, we need to make sure that things like that are communicated. And so one of the things that in communication is, again, having that other person available at the discharge instructions to review that. We need to ask questions. We need to be advocating for our loved one. And we have and I'll go ahead and put it in there now. We have a free form that you can request just to get a download for, and it's called Preparing for the Prep for the Doctor Appointment. And really that can be used going to the doctor's office. It can be used going home from the hospital. It can be used from going to the nursing home and coming back. Basically, it just organizes your thoughts, and so that you can jot down the things that you want to make sure that you ask the physician. The physicians are usually more than happy to answer your questions, and they want to make sure that they're answered correctly, but they do appreciate you having them organized and have your questions maybe written down, so that helps them be more efficient with their time when they have other patients than they need to see as well. So that's one way that you can do that. So questioning new medications, questioning new wound care, questioning new diets, questioning ways they've been diagnosed with a chronic illness such as heart failure or diabetes. Okay, how are we going to get taught? If you are a new diabetic and are going home checking blood sugars and knowing what to eat, your loved one or a family member needs to know. You don't let them discharge you from the hospital if you don't know how to check your blood sugars. You don't know the symptoms of low blood sugars. You don't know the symptoms of high blood sugars and what to eat. Do you have an appointment with a diabetic educator or the dietitian? Who are you going to see? How are you going to get more training? Nowadays, you're in the hospital, 2-3 days, and you go home. That's not a lot of time for you to learn, especially if you're going home on insulin, to learn how to take your blood sugars, to learn how to give yourself insulin, to learn how to manage the numbers. When do you give this, especially if you're going home on a varying scale of insulin based on what your blood sugar readings are. So make sure that you feel comfortable before you go home, that you have the knowledge or you have the resources to get the education that you need in a timely fashion. One of the communication, here's a big thing that happens in communication is, say you're going your transition is, you went into the hospital or your aging loved one's gone in the hospital, and then you're going back home again, and uh, you discharge or you go home on the weekend. It's Saturday or a Sunday or maybe even a Friday night. Your clinics are closed. So who's going to make that follow-up appointment? Usually, depending on why you're in the hospital, anywhere from 5 to 10 days to 2 weeks max. The doctor, the hospitalist, the doctor that's been seeing you in the hospital is going to want you followed up, or your loved one followed up by a doctor to see how they're doing after being discharged from the hospital. And it's the weekend, the clinics are closed. Who's making that appointment? Is the hospital Monday going to make that appointment? And if they are, how are you going to know when that appointment was made? If you're out of town or whatever, are you expected to make that appointment with your primary care physician? Don't leave the hospital without knowing A, when the follow-up doctor appointment is, or B, who is going to make the appointment on the weekend, and how are you going to know that the appointment is made? So these are another errors. I can't tell you how many times, from the hospital, I've called a patient after their discharge and they've missed their doctor appointment because they didn't know. And it was on their discharge instructions they were given, but there wasn't another family member there to hear the discharge instructions. And it got lost in the shuffle with that aging adult. And that can happen. So even though we feel our aging loved ones are alert and competent, they want to get out of the hospital. They want to go home. None of us want to be in the hospital. So they may miss something, or may not ask a question. They may say, oh, yes, I understand. And they don't, and they go home and they don't understand what the next steps are. So it's really, really important to have someone there to go through the discharge instructions with them and not just leave that to them by themselves. So let's run through some other communication tips. So we talked about, when dealing with the doctors, just being clear, concise. Use our prep for the doctor appointment form. You can use that just to help organize your thoughts. Write down questions that you have so that you can, you don't forget, or when you feel like maybe, you don't have as much time as you'd like in the doctor, if you have that written down, boom, 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 you can go through those and get those answers. And, be an active listener as well. Pay attention to the healthcare providers, what they're saying. If something is unclear or you don't understand, there is sometimes, all of us in healthcare, and I try and catch myself in Tuesday tips and in our blogs and in our other education that we do, is not to get caught up in the medical jargon, because I could say something like care transitions. I can't expect anybody to know that's a medical term, what that means. So I have to remember to try and explain that in lay people's terms, what that means. A lot of people, as I'm doing these transitions in care, a lot of people don't feel that they need to watch or learn about transitions in care because they don't understand what it is. So I'm really trying to educate everyone, because this can be, a lot of critical mistakes can be made during these transitions if communication's not clear, or if things get lost during. So for example, going from home to the hospital to the nursing home to home. Well, you go to the hospital. Do they have a correct medication list to begin with? Or are they looking at maybe not an up-to-date list that's in your My Chart that's changed in the last couple of weeks and hasn't been updated? So always have an updated medication list when you go to the hospital, because that is so being admitted to the hospital, whether it's through the emergency room or urgent care, if that medication list is not up to date and current when you get there, that's the very first spot where the first error can occur. Is now you're admitted to the hospital and you have an incorrect medication list. So you're maybe not getting medications you're supposed to, or you're getting what you're not supposed to, or the dose is wrong. So right out of the get-go, we've got mistakes. And so always carry an up-to-date current medication list with you, no matter where you are, because you never know. You can't, if something happens where you've not conscious, you can't speak, they have to have a way of being able to determine these medications. So having one on your person, in your wallet, in your purse, this way, the healthcare providers can have access to an updated list. So that's one of the things that we can do right out of the get-go to help prevent errors. We talked about the errors with the discharge summary. We talked about, they may do wound care in the hospital one way, and maybe the nursing home doesn't have the same type of wound care dressing, so they're changing the dressings. Now, does the wound care doctor know that they're changing the treatment because they didn't order? Well, maybe the doctor would have suggested something else. So every time there's a change, that's a red flag that we need to figure out why the change is, who knows about the change, and making sure either the surgeon, the wound doctor, or the primary doctor is aware of changes. Another thing in communication is when your loved one goes from a hospital to a nursing home, and maybe they're just going for short-term rehab, even something simple as, a voluntary, hip or knee replacement. That's an elective surgery. They've chosen that. When they're there for 6 weeks or so, when do they see their doctor? Are they going to see a doctor at the nursing home? Can they still see their primary doctor? When are they going to see the surgeon after they leave the nursing home? What are those follow-up appointments look like? So those can be lost in transition. Many times people don't understand that sometimes nursing homes would want to have you see the nursing home doctor, and they don't. You don't go to your primary care doctor. You should be able to, but then again, we have transportation issues. Some nursing homes can provide transportation and will take you to your own doctor. Other nursing homes don't. And you can go to your own doctor, but maybe a family member has to provide that transportation. So communicate, communicate, communicate. You can request a copy of the doctor's discharge summary when you're at the hospital. They may ask you to sign a medical release, but it's, your aging loved one's records, and get that so that you have something to compare to when you go to the nursing home. Here, I have in my hand, this is the most recent discharge summary. Is this what you're doing? So you have something to go by. You have what medications they're supposed to get, what their treatment they're supposed to get, when their follow-up doctor appointment's going to be, so that you can make sure that when they're in that nursing home, that everything is just following in suit, that everything is going as planned. So don't hesitate to ask for those things. So imagine that your aging parent or aging loved one is transitioning from a hospital, say like we talked about the nursing home or the rehab. So they're just going for a short period of time, and then the plan is going home. So during the discharge meeting, they may call it a discharge meeting. They may call it a care conference. Usually there's a meeting or several meetings with family, all the people at the nursing home, the patient, putting together a plan for going home. And all this is your opportunity to make sure that you understand any medication changes. What does it look like when we go home? When are we expected to go home? You should not go to a care conference and they say, well, we're planning on discharge tomorrow. That's not acceptable. That no way should that happen. And I would really encourage you to push back a little bit on that. And they may not like it, but if you have things that you need to get ready and they gave you such short notice, it's not a safe discharge plan if you have to get things ready at home or get equipment in there. So it's okay to push back. It really is. And so ask about medication. What are services? What happens when we go home? If you had this wound care, or they have, they're going home with tube feedings. How am I supposed to know how to do this? Are they setting up home health care? If they're setting up home health care, who's going to call and set them up? Do I need to call? Are you calling to arrange that? How does that get paid for? Does insurance pay for that? So, just ask question after question after question so that you are fully aware of everything that's going on. So, and same thing from going home from the hospital to home. Maybe that you need home care or outpatient therapy. Are those appointments set up? Who's making those appointments? What are the expectations of that? Does the insurance cover that? Am I going to have any co-pays? The last thing you want, due to a lack of communication, is to have something from the insurance company denied because somebody dropped the ball and didn't provide the necessary information to the insurance company. And sometimes it's a piece of paper faxed to the insurance company, and it's a shame to have a denial when there was missed communication. Make sure that any care plans, like we talked about the discharge instructions, they make sense to you. You understand them. How am I going to get education? When you're at the nursing home too, during a transfer, say you're going from the hospital to the nursing home, it's okay to say, hey, mom prefers to have her meals at specific times. Is there any way we can arrange for this in the nursing home? Chances are maybe not. Some places may accommodate you. A lot of places don't anymore, and they really don't even have special diets in many places anymore. They just do a heart healthy, generally healthy, low sugar, low fat kind of a diet that kind of blanket covers everyone. So it's not always even uh, an expectation anymore to get special meals when you go to a nursing home or an assisted living. Allergies, food allergies. Now that's another story. They have to accommodate those food allergies. So make sure if your aging loved one has a food allergy that that's communicated and it's clear so that we don't have them getting any food, obviously, that they're going to have an allergic reaction to. We talked about home health. We talked about if the healthcare providers are using medical jargon and you're not understanding the terms, please ask them to explain things in a way that's easy to understand. Um, Make sure that you're with your loved ones, make sure that you're acknowledging their feelings, that you're asking them questions. Is there anything else that you want to do? Maybe you understand, but we also want to be sensitive to our aging loved ones and ask them, do you understand? Let's say your dad needs to move assisted living. You might say, hey, Dad, I know this is a big change for you, and I want to ensure you're comfortable with everything. Let's talk about any concerns you have, because this will go a long way in getting their buy-in and, again, increasing the communication with the staff and your aging loved ones. So, to wrap up, communication is really the cornerstone of successful transitions. And by preparing thoroughly, listening, asking questions, engaging the healthcare providers and your loved ones, try and put yourself in their shoes, asking for clarity. You can make these transitions smoother and a more positive experience. And then along with that, reducing the most important thing, and that's mistakes and errors. So practice these tips, try and adapt them to your unique situation. You're all doing an incredible job as a caregiver, and every effort you make counts. I mean, this is truly a labor of love, and I commend all of our caregivers out there, because this can be a tough journey. So we are here. You are not alone. Thank you for stopping by and checking out. If you're seeing us live, thank you. I know we had a couple people pop on. And if you're catching the replay, we really appreciate you trusting us with sharing some information to help your caregiving journey and caring for your aging parents a little bit more smoothly. So with that being said, we're going to go ahead and end this Tuesday Tips, and we'll see you back next week at another Tuesday Tips. Take care, and we'll see you soon.